Hi friend, I'm Dr. Denny Tang. Today I'm going to share with you a few important points about a special test called the Comprehensive Digestive Analysis Test. This is one of the very important tests to take care of our gut health. Normally this test is a very specialized and advanced test that is not available locally, and then we have to send it abroad to United States. It take about 3 to 4 weeks to have the results. So there are many pages to this test. I'm going to summarize a bit of the benefit we might get in doing this test. The first few pages will tell us something about the internal bacterial conditions, which comprise the good bacteria and bad bacteria and ugly bacteria. What are these? So the good bacteria, something that we commonly know of is telling us something about the probiotics. The good bacteria that normally reside in every healthy human beings. It tells us about that. And also the bad bacteria are the famous bacteria that's caused gastroenteritis, like cholera or salmonella or pseudomonas, those kinds of things that shouldn't be present in a healthy individual. And it also contains the worms and the parasites and the fungus that possibly in our gut that's causing us the problems in an unhealthy individual. And thirdly is the ugly bacteria. Ugly bacteria is also is a kind of bacteria or fungus that normally can be in our gut, but normally in a very small number. But when they overgrow, that may cause problems. These include candida or some types of pseudomonas or some types of klebsiella, as you might know. And then it's very important to tell us that everybody may have heard of H. pylori, which is a kind of bad stomach bacteria. This H. pylori might cause all the problems in our stomach and causing indigestion and producing a lot of gas. That means if we know with this is no good, and then we have to eradicate them, Apart from this, we can also tell something wrong, what's wrong in our small intestine, particularly the methane producing bacteria. If we know them, then we can also solve the problems apart from the large intestine and the stomach. We can solve things in the small intestine. Apart from that, there are also other parameters that can tell us something about pancreatic enzymes, liver function, and also how inflamed our gut is. For the inflammation, there are a few items that I particularly want to highlight, include anti-gliadin IgA and anti-secretory IgA, which signifies how inflamed our gut is. If these are raised, then we may need further tests in future, like those like some kind of blood tests, like the ESL or CRP, which are the inflammatory markers in our blood, and may also need further tests like Precision 100 is the food allergy test that tells us something about IgG or IgE, IgA, that we can pay more attention to that in the future. So, and also these other parameters also include the calprotectin, which can be related to some kind of serious inflammatory disease like celiac disease, ulcerative colitis, or Crohn's disease. So if you find our gut is inflamed, we know how severe we are going to have our inflammation is. Can give you a little bit of the information how we're going to treat them. So let's say if there is some inflammation in our gut, what we can do is as we said, is the food allergy test, or some people may need to avoid some kind of food like gluten, right? But that need to be decided. The other side is that we need to, if there is some inflammation, and then actually After you are going to save the stool, there will be no longer any delay in treating you. So while waiting for the test that take about 3 to 4 weeks, we can start immediately giving you a few tablets like intestinal clear and some enzymes, and also we can give you the paragon. These three capsules that can help getting rid of some of the bad bacteria if they are present, and also we can give you, and the enzymes can help you with your digestion, and also the paragon can help repair your gut. Hopefully, we give you some information about this comprehensive digestive analysis, and preliminarily how we can help you right after you have saved the stool. And while waiting for the test, we can also offer you some kind of treatment. We can start off immediately, so that in a few months time we get the results back, and can with the right medication or treatment or food avoidance or further test, your gut problem may be solved within a short period of time. So hope that you find this enjoyable, and then we'll see you if you have any gut problem, and we are looking forward to helping you very much in this regard. Thanks very much.